It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Well, this has become a rather controversial topic, that of immunizations, and we're talking with Dr. Maggie Chou, a pediatric physician from the Everett Clinic, Shannon, and this has become kind of a matter of personal belief in some cases, medical doubts in other cases, but I think most physicians agree an immunization is pretty essential.
All the physicians I've ever talked to, it's important to immunize.
All right, here's Shannon O'Kelly and Dr. Chou on Como.
Dr. Chou, welcome to Health Talk. How are you?
I'm doing great. Thank you.
Thank you for joining us. You're a pediatrician with the Everett Clinic. Tell us about your practice and your area of interest, and how did you get interested in pediatrics? It's a great field, isn't it?
It is. It's a really fun field. I am practicing at the Everett Clinic. I've been there for 11 years. I practice at the Mukilteo Harbor Point site, and pediatrics is just fun.
It's just fun.
Yeah. I enjoy working with the kids and the families, and it's really nice to have that shared goal of raising happy, healthy, well-adjusted kids who will become happy, healthy, successful adults. And it's great to have that relationship with the families.
Tell us, generally speaking, age ranges. I mean, you go from a newborn and probably around 18 or so. I mean,
what is the age limit? Pediatrics is up to 18 to 21. I will see kids up to 20, 21 years old, depending if they want to still come see the pediatrician or not.
Right, exactly. I've always admired what you folks do in pediatrics. It's always so amazing that you are not able to. Most medicine and healthcare, we get a lot of information with our history and physical where we can actually talk to the patient, right? And you have a little different avenue because, a 6-month-old is not going to tell you they have a stomach ache, right?
Yeah. I mean, there's a lot of detective work
it is. That's
observation.
Yeah. And then talking and integrated the parents and then being a pediatrician, sometimes parents, there's anxiety being a parent. And when your child gets sick, I mean, you deal with a lot of not just physical, but also mental aspects of healthcare, dealing with the family.
Absolutely. The family is a unit, so you can't just treat the child by themselves. It's really the child and their family, and trying to understand where they're coming from and what's best to make sure that they still stay healthy.
Tell us about your training. Did you do anything special during your training? Do you have an area of your practice where you really like to emphasize that?
I trained as a general pediatrician, which means I will see everything, but I do really like the preventative side of medicine, so trying to make sure that, people keep from getting sick and, trying to make sure that people are healthy and doing all the healthy things to prevent illness.
You just did a great job queuing up our topic today, okay? Good work. You've done this before, haven't you? You're doing a great job. I want to talk about immunizations. I mean, we know in the media there's a lot of controversy being a pediatrician. Let's break it down into stages, newborn, 1, and then on to school, because it is that return to school time. Kids are getting back to school, have started again in school, but there's requirements, immunizations. And let's talk about those stages of immunizations.
Sure. So maybe we'll start with what a vaccine is and how it works.
Perfect.
So you can think of a vaccine as a way to train your immune system to help protect you against illnesses that your body might see in the future. So a vaccine has proteins that are called antigens, and these antigens mimic certain pieces of viruses and bacteria. And when your body sees those antigens, your immune system starts making antibodies and memory T cells. And so when your body actually does see that illness in the future, your body says, hey, I've already seen these proteins before, and I already know how to fight out against it and have the defense to protect you from it. So that is the goal of the vaccine.
Isn't that amazing? Isn't the human body just amazing? So what you're saying is that basically you're training your immune system to attack this antigen that can be bad for us. And once that you have immunity to that antigen, you have immunity essentially for life. I mean, for the most part.
For the most part. So there are vaccines that give you lifelong immunity, but there are also vaccines that are temporary and help protect you during certain times when you're most vulnerable, such as an infant, where there are diseases that can be pretty serious in terms of complications and infections that infants can be exposed to that aren't as serious as when you're an adult. So that's why there are immunizations that are important to get as a baby as opposed to when you're already older.
So if we think about it and break it down, when you're a baby, you've got this kind of a naive immune system. We're trying to kind of train it and enhance it to fight those things that maybe are bad for kids at those certain ages, right?
Right. In terms of the schedule for immunizations, there's a lot of research behind when each vaccine should be given to help give you the most protection at the right time.
All right, more with Dr. Maggie Chou and Shannon O'Kelly coming up next right here on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
More with Dr. Maggie Chou and Shannon O'Kelly on immunizations.
Dr. Chou, again, thank you for joining us. You've done a great job kind of talking about our immune system and how we're trying to kind of enhance it, and particularly as kids, to fight off these bad things that maybe we can get. And you talked about timing. Let's talk about some timing of vaccinations and maybe that continuum up to 18 if we can in a limited time. Maybe we can talk about a schedule here. What's important?
I would say all the immunizations are important.
Yeah, good point. That's a really good point. Thank you.
As a baby, the things that we worry about the most are the bacteria that can get into the body and cause more serious illnesses like meningitis and pneumonia and things that the baby's body just isn't prepared to handle. So the things that we want to try and help protect babies against are things like whooping cough, which can cause a lot of respiratory symptoms, things like pneumococcal bacteria and Haemophilus influenza bacteria, which can cause meningitis. So really it is trying to help protect from those serious illnesses during the infant stage. And then as you get older, you start to get immunizations for MMR, which is measles, mumps, and rubella, and chickenpox. And those are the main vaccines that you get before kindergarten.
Are they still vaccinating for polio?
And polio, yes.
And polio,
yes.
So that's before kindergarten. That's
correct.
Early. And you know, in some parts of the world, polio exists. It's pretty amazing.
The nice thing about vaccines in the U.S. is that they've been so effective that we don't see a lot of these illnesses anymore.
Good point.
So sometimes people get worried more about the vaccine than the illness because they haven't really seen what the illness can do.
Right. And if you've ever seen what the illness can do, you appreciate the vaccination.
Absolutely.
Oh, for sure, especially in your field. Because when you see a child that's miserable with whooping cough, and it can be vaccinated, that's tough to watch. And so what about as we get into school year? We're in first grade and we go through our grade school years. There's timing there also, right? I remember in my day they did it at school. You stood in line with your classmates and got vaccinated right in school, like the school gym. It was terrifying when you walked down to the gym. You know what I'm saying? So, go ahead.
Yeah, so I would say, most of the vaccines you get before kindergarten, and you're protected for a good number of years. You do still want to get your flu shot every year.
Good point.
But really, the next set of immunizations is before middle school. So that is when you start getting your booster for your tetanus and your whooping cough, your meningitis vaccine, and your HPV vaccine, which is the human papillomavirus.
That is an important one today, isn't it? That's one that we've not seen a lot, but more common now, right?
It is a newer vaccine. The main goal of that vaccine is to prevent cancer, which is an amazing goal to prevent cancer.
Absolutely. What about off to college? Sending off to college. As we wrap up here, anything that to summarize, like meningitis is a big one.
Correct.
And so, is there any other college vaccinations as you send your kids away to college?
By the time you get to college, you should be protected against all of the diseases that we vaccinate for. So after college age, it really is just tetanus every 10 years. And then as you get older, there are some adult immunizations that you'll need later. But yeah, a lot of the immunizations that you're getting as an infant really will help protect you for the rest of your life.
Man, great job. Great information. Thank you so much for your time. And I'm going to get my flu shot for sure. It's going to be earlier this year, I think, but I'm going to get one.
Great. Sounds good.
That's been Dr. Maggie Chou, pediatric physician for the Everett Clinic. More info at everettclinic.com. Shannon, again, immunization, something that a lot of people, especially now that we're in the late stages of August with back to school, very important.
It's really important, not only as a child, but I think there's also boosters you need to look at as adults. Tom, you and I probably need to look at our boosters.
Absolutely. We'll be back with our final guest, Rachel Byrne, coming up after this timeout as we continue with IRG Physical and Hand Therapy's Health Talk on Como.